Hello, I hope everybody is having a good week thus far. For tonight, what we're going to cover is case conceptualization, or basically the clinical process within behavior analysis, specifically for addressing problematic behaviors. Now, of course, through the semester, we'll talk a little bit about skill acquisition work and how we go about designing programs to do that. But for the majority of this class, we're going to talk about reducing problematic behavior, because that is a lot of the work that behavior analysts are currently engaged in, particularly within New Jersey. I guess, but before getting into the basics of this, it is worth talking a little bit about the general avenues in which we might be contacting that sort of work. So clearly, if you're doing school-based consultation, there are students within schools who engage in problematic behavior that require behavior analytic services. And of course, we would have to do some form of functional behavior assessment for that. A lot of the in-home services, in-home behavior analytic services, are focused on reducing problematic behavior. They are funded through the children's system of care, through state services, and basically service providers, behavior analytic service providers, receive referrals from the state, and that is the first point of contact. And of course, if you're in private practice or working at a clinic, you would encounter individuals who engage in some form of problem behavior. So it's not the only thing we do, but it is a lot of what we do as behavior analysts. So I think it's worth reviewing this process. Clearly, there will be overlap with ABA 510, possibly even ABA 511, and so forth. So let's get into the lecture. So basically, when I say case conceptualization, what I'm referring to is how do we as behavior analysts go about analyzing a case? How do we begin to address a problem? Right, so let's think broadly here, not specifically jump into functional behavior assessment, but when we see behavior, how do we go about conceptualizing the variables that are influencing that behavior? So we could talk, and case conceptualization is something that exists in the field of psychology at large. So it's something that a clinical psychologist would talk about, as well as a cognitive psychologist. And I think as behavior analysts, we should utilize this term as well, case conceptualization. So basically, the idea here is we are going to formulate a hypothesis about the etiology of clinical problems. So what are the causes? And we know for us, when we think of etiology of a clinical problem like self-injury or aggression or tantrums, we're going to look to the environment, by and large the environment, right? And a good case conceptualization will allow us to not only analyze behavior thoroughly, but it'll allow us to conduct the most appropriate type of assessment, right? Which will lead to an effective intervention. So that is one of the goals of essentially your first point of contact with the client, is to begin to, as quickly as you possibly can, begin to formulate a hypothesis or conceptualize what is happening with this particular client in this given environment, and what assessment am I going to conduct to reveal the variables at play. Hopefully that makes sense. So essentially, what is the clinical problem, right? Clearly, to receive funding for services, there has to be a diagnosis. So diagnoses can vary. They don't really inform what we are doing as behavior analysts. So a diagnosis like autism doesn't necessarily give us any indication about what problem behaviors are present for a given individual, or what skill deficits there are, because there's so much variability across individuals. But nevertheless, a diagnosis is based on behavioral clusters, right? So is there deficits in social reciprocity? Are there stereotypic behaviors present? Is there problematic behaviors present? Things of that nature. So diagnosis is clearly important, and we attend to it. It just doesn't necessarily inform what types of assessment we're going to conduct and what types of interventions we're going to design. For us, it is a specific challenging behavior, right? What is the challenging behavior? And then, of course, we're going to start to look at the antecedents and consequences surrounding that challenging behavior to have a thorough conceptualization of what's happening. So first and foremost, we have to be able to pinpoint the clinical problem in terms of observable behavior. We have to identify the target behavior, come up with an operational definition, and begin to measure that behavior appropriately. So this area sort of brings us back to ABA 502, selecting and defining behaviors and then designing measurement procedures. We will talk more about that next week. So I'll present some material that reviews that process thoroughly. So that's sort of step one in a sense. So again, for us, when we conceptualize a case or the causes of behavior, we are going to rely on our three-term contingency, antecedent, behavior, consequence. So I can't underscore enough how important it is to always try to break problems down into this simple three-term contingency. Right? When you walk into a setting and you begin to interact with a client or interview the parents or a teacher, this is what we're doing. We're trying to take the problem at hand, what's being verbalized to us by a parent or teacher, or what we're quickly observing a client in a given environment. We're trying to break it down into these areas. Clearly, we need to sort of delineate the behaviors. What's occurring? Is it aggression, self-injury? What are the topographies of those behaviors? And we're going to formulate a good list of target behaviors and operational definitions, and of course prioritize those. Right, self-injury would take priority over tantrum behavior, things of that nature. And to really thoroughly analyze what's happening, we are going to conduct a functional behavior assessment. And hopefully remember from ABA 510 that this essentially is a set of procedures for defining events and environment that reliably predict and maintain behavior. So it's not one thing. We're going to go through a set of procedures or a process to thoroughly analyze what's happening. And it is not, again, a functional analysis or even a full FBA is not sort of these generic procedures that you just run through. Sometimes you have to begin an assessment, analyze the data, which might cause you to shift the focus of the assessment, right? So when we talk about functional analysis, we are designing that analysis. Clearly there is a sort of template for doing so. There are certain conditions you could select, certain ways of running those conditions, but it's a template that we can vary to address a specific or ask questions about a specific clinical problem. So the FBA process does guide us through this case conceptualization. It'll help us design assessment, and clearly it'll help us design interventions. So let's look at an example, focusing on that three-term contingency. So here we have a scenario. Each time the parent presents an instruction to Bobby, he engages in aggression. The parent gives him his iPad to calm him down. So let's consider the possible antecedents. Well, clearly the verbal instruction is the most apparent antecedent. So that's going to be the first thing I would consider. So if I were to be thinking in terms of functional analysis, which we'll talk about later, I'm probably going to include a demand condition. But what other variables could play an important role in this parent presenting an instruction? Antecedent variables, that is. The tone of the instruction, the type of instruction. In fact, that's probably more important. Is it an academic demand? Is it an activity of daily living like brushing teeth? Or is it something like a chore, cleaning your room? we could look at that. I wouldn't go there immediately, but it's something that I'm attending to when I'm observing. Is it a possibility? Could be, is it just that the parent is providing the instruction, or would any adult instruction evoke this aggressive behavior? And then, of course, there's a current environment, right? So a consideration, if I'm observing in the home, would be, is this something unique to the home when a parent provides an instruction or an adult provides an instruction, or does this occur in every environment? So these would be things I would be considering, right? The thing that's apparent is a verbal instruction. So I'm automatically thinking demand, condition, possibly escape, maintain behavior. But there could be other antecedent variables at play. So I'm going to start basic, and then if I need to drill down to these other variables, I might do so. The behavior is apparent here, so we're not going to talk about that. But certainly in an observation, I'm going to look at all the topographies of the behavior and make sure I have a good operational definition. So let's shift to the consequences that are apparent and ones that may not be apparent but could be important. So the parent gives him his iPad to calm him. So clearly there could be an escape consequence, right? First, there was an instruction prevented. Bobby aggressed. Now he's doing something else to, from the parent's perspective, calm him. So he clearly escaped the demand, the initial instruction, even if for a short time, escaped or avoided the demand. He also received access to an iPad. So there's some tangible activity that's been delivered, probably more preferred. So we have we could compare non-preferred to preferred activities. And then there's some access to parent attention. So these would be possible consequences that we'd want to look at. As I mentioned, clearly the most apparent one is he escaped the demand. But then going to more fine-grained analysis, you could look at some other possible variables. So here's another clinical scenario. Billy elopes from the classroom and runs to the cafeteria multiple times per day. So again, in the absence of other details, if we're looking at this and breaking it into the three-term contingency, the first thing that's very apparent is the behavior. He's eloping, so clearly we would want to be able to define that and design a measurement system around it. But then looking at the antecedents, he's running from a classroom. That's all we know at this point, right? So an antecedent condition would be the presence of the classroom. Other things that may be possible that we'd want to look for is, in that classroom environment, are there conditions of attention versus no attention? More specifically, does he elope when he's receiving attention or when there's no attention being delivered? Another possibility may be, is he eloping when there is an activity versus no activity, or is it a specific activity? So these would be things we want to look for in this clinical scenario. Let's shift to the consequences. So he's running to the cafeteria, and it occurs multiple times per day. So possible consequences, working in sort of a hierarchy here, would be he escapes the classroom first and foremost. So again, reflecting back on those antecedents, is there anything in the antecedent conditions that would motivate him to want to escape from the classroom? Right? Is is there work required, or it's just no activity? Things of that nature. So other consequences, he accesses the cafeteria. So he's going to a particular place. So we'd want to consider that. Is it that he just wants to get out of the classroom, or is he always running to a particular location? Do the aides chase him? Right? This is something that typically you might see in a elopement situation, that there's somebody chasing him. Also, What happens when he actually gets to the cafeteria? So what's happening in that location? Are there other reinforcers being delivered? So these would all be possible consequences. Now, of course, elopement can be a difficult behavior to assess because of the danger involved. But if you look in Java and other journals, there are a couple variations for designing assessments to determine the function of elopement. So we could certainly do that. Okay, so those are sort of the basics, right? We're just thinking of behavior environment relationships in a three-term contingency. Of course, we are going to move to a functional behavior assessment, and we know that that is a set of procedures to define events and environment that reliably influence behavior, predict and control behavior. So we want to get to an area where we can ask the question, what is the function of this behavior? And of course, that observation and conceptualization is a first step. And then we have our functional behavior assessment steps, right? Moving sort of in a direction of indirect assessment to more thorough analyses. So we're just simply trying to identify the reinforcers that maintain a given behavior. Is it social positive reinforcement, attention seeking, gaining access to a tangible? Is it social negative reinforcement, escaping an already aversive state, like a classroom, or avoiding the delivery of instructions? Is it automatic positive, some form of self-stimulation, or is it automatic negative reinforcement, some form of pain attenuation? And generally, when we're doing an analysis, we don't always make a distinction between automatic positive and automatic negative. It's clearly just defining the function of automatic reinforcement. So we begin the process of functional behavior assessment. Now, again, in any clinical case, the first point of contact with the client or the client's caregivers or teacher is the beginning of the functional behavior assessment. So it could begin as early as the referral process, where you receive information about the particular client. At that point, you'd be conducting a record review, looking through medical charts, looking through individual education plans, looking through teachers' notes or physicians' notes, just to get a better idea of when did the problem begin, maybe even some indication of what it looks like. Has there been serious injury that's resulted from the problem? So record review is the beginning of the functional analysis. And again, as I mentioned, it could begin as soon as the referral process. Then when you make that initial phone call or initial consultation meeting with a parent or a teacher, that is part of the interview process. So that, again, you're already beginning some steps in the functional behavior assessment by conducting indirect assessments, right? You're doing record review, you're interviewing people, and you're going to do all of those things that we talked about in 510 by way of the indirect assessment. You're trying to get an idea of what the problem is. You're beginning your case conceptualization, and really, in a sense, going from a broad conceptualization to a very fine-tuned analysis. So that's that. We then would move to direct assessment, conducting some form of direct observations. You can elect to do descriptive assessments. We talked about some of the limitations of those, but if it's the only approach we have, or if we feel it's useful for our analysis, conducting a couple descriptive assessment observations is certainly warranted. And then you should be thinking about some form of functional analysis, right? Even if it is a simple test condition versus a control condition, to verify the hypothesis you formulated through your indirect assessment, and of course direct observation. So again, just as a general review here, this functional behavior assessment process begins quite early in any clinical scenario. And in some instances, you're combining approaches, meaning as I indicated, when I first meet with a family and I'm conducting my interviews with the parents, if the child is there, if I'm doing the interview in the home, I'm also looking at direct assessment procedures. I'm directly observing the behavior. Maybe I'm trying to collect data at the same time. So it can be a quickly moving process, right? And when you start talking about state-funded services, I don't recollect off the top of my head, but I think you get about 2 weeks to complete a functional behavior assessment. So you do need to move swiftly. And in terms of scheduling appointments for observations, it can be challenging to get them done within 2 weeks, but I believe that is the average for state-funded services. So let's consider some basic steps. You receive the referral. Either in that referral or before you get started, you probably want to make sure that there is some examination by a physician to rule out other possible causes for the problem behavior. In some cases, the medical doctor may have made the referral for behavioral services, that this individual is presenting with self-injurious behavior, there are no underlying medical causes, this should be assessed by a behavior analyst. So this medical examination or physical examination by a doctor is an important step, and it is the first step. It is not always formally initiated by you as a behavior analyst. So for example, in my experiences, I don't always say, well, I need this medical exam done before I get started, but I definitely ask to make sure that that has been done. Has the client seen a doctor about this problem, and what were the outcomes? And if the parent provides me information saying that yes, they saw the doctor said there is no medical cause for the problem, then I'm safe to proceed with the functional behavior assessment. So then I'm going to begin to gather my information via indirect assessment, record review, interviews, and then maybe conduct something like the functional analysis screening tool or some other tool like the questions about behavior function. I'm going to interpret that information and formulate a hypothesis about the function. What is this behavior and why is it occurring? Then I'm going to move to try to test the hypothesis using a functional analysis. So this is the part that we really need to think carefully about, right? What conditions am I going to use, and how am I going to do this safely and quickly? So that would be particularly important. And then, of course, once we generate results, we're going to develop and evaluate the intervention, train parents and caregivers, and move to discharge. That would be the process. Hopefully, these services don't take extended periods of time, but sometimes they do. I've worked with clients for up to 2 years. Other ones were able to discharge within the year. And that is the goal of many of these state-funded services, is to get in, do your analysis, eliminate the problem behavior, train parents on the protocol, and fade yourself out, which is probably the more difficult part, training parents and fading yourself out. So here I have a basic flow chart of what we might do. Right, so I'm not going to read through these. You can read through those yourself, but it is the basic process. The details is where we do a lot of our fine-grained analysis. Okay, so let's just focus a little more carefully on some of these, this process, beginning with indirect assessment. So we review past records. We develop and prepare questions to be asked during an interview, right? This is important. Now, referral packets vary in quality. I've received referrals with a simple diagnosis and what the problem is. In fact, when I, working through the New Jersey Children's System of Care, those services, basically there's a system within New Jersey. It's an online system called Cyber. And when you work for an agency, they get referrals, and then they'll kind of connect with you as behavior analyst and send you the referral. And I've received referrals that simply say it's a child who lives here. This is the age. The diagnosis is autism. The problem behavior is aggression. And that's all I get. In other areas, when consulting to a school or working for clinic settings or more institutional based settings, you get a referral packet, sort of the whatever history exists up until that point, the reason why you are being called. So sometimes it will have a lot of detailed information, any hospitalization that's occurred, even some descriptions from other behavior analysts. So the referral packet can have a lot of information or not so much information, but the what I use those for, or what I use that record review process for, is to get a broad idea of what's happening, and then it allows me to develop and prepare questions that I'm going to ask during the interview. Right? So if it has the target behaviors listed in the referral packet, I may simply jump to say the referral says this. There's self-injury, aggression, property destruction. Are there any other target behaviors? Rather than sort of going more broadly and working that way down. So any information you get from the referral packet, you're just verifying that it is correct, and then making sure there's nothing that was left out from that referral. Of course, you're going to gather any general information, and I will, in a week or two, we'll look at some of the general questions we might ask during an interview. Behavior-specific questions: what are the skills? What are the deficits? What are the challenging behaviors? We'll ask about potential reinforcers. So all of these things that we talked about in 510. Certainly we're going to utilize some assessment tool. I tend to prefer the FAST, but any tool that has some utility is worth using, knowing the limitations of these tools. Then we're going to review the content with the parent and the caregiver and explain the next steps. So at the end of an interview, or maybe I have a couple interviews during the week, right, where I come into the home 2 or 3 times during the week to ask questions and conduct observations, right? And that might be a sort of back and forth process where I interview, I kind of gather this information, then I conduct observations, and I'm comparing my observations to that information I gathered. If I saw something new or something that was not presented in the interview, then the next time I interview, I'm going to follow up on that. But more importantly, I'm confirming what was conveyed to me in the referral packet as well as the interviews. And then I'm going to explain the next steps. So it could be as simple as, well, I'll come back tomorrow to conduct more observations, or a more thorough description of what will happen. I'm going to conduct more observations. At the end of my observations, I will begin to analyze this information and design a more thorough analysis, and that will entail me coming back and doing A, B, C, and D, right? So I'm describing what's going to happen. And then in many cases, you would summarize these findings in a report. So again, with those state-funded services, you have to enter progress notes into this system, online system called Cyber. And you're entering all your observations, your functional analysis results, your functional behavior assessment results, and so forth. So this is common practice. It doesn't occur everywhere, but I do want to, part of this process of a clinical simulation will be to teach you more about writing these notes, progress notes, and so forth. So the summary would basically indicate these are the target behaviors, these are the operational definitions. We're going to measure these behaviors using these procedures. Obviously information about the sessions or observations, when they were done, where they were done, what was the duration. And then you're going to begin to prepare some materials for your next session. Also, as an early part of this process, I suggest doing a stimulus preference assessment. So my general strategy would be to conduct my indirect assessments, start conducting observations, and let's just say this is a 3 or 4 day process. So I conduct interviews and observations during days 1 and 2. Then I come in to do a preference assessment on day 3. I could also conduct observations. So, my tasks are sort of running this stimulus preference assessment, also observing for a short time, following up with the parent. And if this were school-based consultation, it would look the same. So we know what preference assessments are, but I'm going to conduct one early on because it's a good initial step. It helps foster a positive relationship with the client. Also, parents seem to really enjoy these because you're doing something fun and positive with their child. And it identifies potential reinforcers. Now, again, I know I'm focusing heavily on these state-funded services because this is a large portion of what jobs are out there. And as part of the functional behavior assessment, they do ask you to conduct or identify reinforcers. So this would be a part of the process. Okay, and we know that there are a couple different preference assessments we can select from. I typically use a paired stimulus assessment. Some folks elect to use a multiple stimulus assessment. Some combination of both maybe. The thing you need to keep in mind or remember from ABA 510 is it's better to assess multiple stimulus classes separately, right? So if you think you're going to be using food for reinforcers to motivate appropriate behavior, you should probably conduct one assessment with food, another assessment with leisure activities. Now again, what we're selecting to assess is going to be determined by your interview with the parent. Are there food restrictions, right? Are there concerns with using edible reinforcers? That would all be discussed as part of the interview. Other things we need to consider is, are we going to include stimuli in the functional analysis, right? So if a parent says, well, their favorite activity is using the iPad, I may include that in a stimulus preference assessment, but I have to consider, is that something that can be used to motivate behavior, or is it something that I might use in the functional analysis? It can be both, but I like to separate preferred stimuli to those that are used in the analysis, excuse me, or those that are used as reinforcers in a behavior intervention program. And then, the basics. We're going to prepare all assessment materials before the session, conduct the assessment, summarize the results, and as I mentioned, determine which stimuli to use in session or reinforcers to motivate appropriate behavior. And again, this might be written up in a report format. So we will do this through our clinical simulation. The goal is to move to a functional analysis. Now, we talked extensively about functional analysis in ABA 510, and I'm sure we discussed the challenges to doing functional analyses in various settings. So there's a lot of consideration that goes on in the conducting a functional analysis. And I think there's a lot of anxiety, even for people with their BCBAs, particularly those who do not have experience conducting functional analyses or just are not well versed in functional analysis. So it is bad practice, but a lot of folks will do these assessments, functional behavior assessments, without ever doing a functional analysis. and that's something that the field is struggling with. I think you're more and more seeing an emphasis on getting functional analyses done. In fact, I probably mentioned in AB 510 that I do work with the state through Autism New Jersey, and we're informing them about best practice in behavior analysis. And there's a big push from our committee to require functional analyses be done as part of the assessment process. So that's something that clearly will be happening at some point in the future, but I would like to see all of you going out into the field and being confident in doing these things. So the goal here is we're going to use our indirect assessment results and design conditions to test our hypotheses. And we know, again, there is a template, the 4 conditions that seem to be a standard. We don't have to do them exactly, but an alone condition, attention condition, demand, and a control. Then we know that there are other conditions that we could use: tangible, divided attention, and we know that we can vary these conditions or modify them in some way if needed. So my recommendation is start basic, and then if you need to drill down with further assessment, we can do that. So right now, let's just focus on, we need some test conditions, or at least a test condition and a control condition. The test is going to include some setup or delivery of an antecedent condition and some delivery of a consequence. The control needs to be an elimination of all the suspected influential variables. So, for example, and I have a couple examples on the slides that follow, but let's just keep things basic now. If my indirect assessment points to the problem behavior being maintained by attention, right? So we get information saying that, well, when I attend to other students, the child tends to act out, or when I'm cooking dinner and my child's left alone, they tend to engage in self-injury. Those things are pointing to an attention condition. So at the most basic level, designing a condition where for some period of time the child is not receiving attention. So we have an antecedent condition. Maybe there's not a lot to do, so low preferred activities. But contingent on problem behavior, we deliver brief attention. That is a basic test for social positive reinforcement in the form of attention. A simple control condition would be high preferred activities and periodic attention, or even continuous attention. So let's just say we're in the home environment. One quick test we might do is simply alternate between in 5-minute intervals, perhaps. You have a little timer, pen and paper data, and you have columns for test condition versus control. So you have 5 minutes of, hey, let's do this fun activity, and you're providing attention. And you say, okay, that's done. And then you remove the materials. And then you have 5 minutes of you ignoring the individual, but when they engage in problem behavior, you provide attention. And you're just marking down under what conditions the problem behavior is occurring. So that's sort of a crude functional analysis. But again, better than indirect or descriptive assessment, because you're actually manipulating the variables, right? You're doing what may be happening in the natural environment. Obviously, we could go to the sort of formal template for functional analysis and utilize any of these. Let's ignore this SD part here. Again, if you remember, this is a particular therapist in a particular setting. In a lot of clinical settings, we don't have the luxury of having multiple therapists participate in an analysis or doing the conditions in multiple settings. So we know that we can include all of these conditions, and that the important part of these conditions is setting up antecedent variables that establish the consequence as a reinforcer, right? So the delivery of demands establishes escape as a reinforcer. So if that's an influential variable, we're likely to see problem behavior here. Alone, conditions are difficult to run unless you have a session room with a one-way observation window. So often what we do there is run an ignore condition, right? So whether you're in a home or in a classroom, you kind of make sure there's not a lot for the individual to do, and make sure they're safe, of course, and observe covertly if you can. The attention condition, pretty straightforward. And then, of course, again, the control. We need to eliminate any potential establishing operation for a particular reinforcer. So in most control conditions, what we're doing is trying to deliver all possible reinforcers. There's no demands, constant attention, high preferred items, right? So if life is good for the individual, there should be no problem behavior. And that is important. We want to make sure that in the control, there is no problem behavior. So again, let's go back to our examples here. This is the one where the parent is presenting an instruction to the child. He engages in aggression, so the parent gives him an iPad to calm down. Now, this is a cursory overview of what might happen, but I think, again, just to give you some foundation for our line of logic here. So we have our antecedent and consequences listed. We're going to start simple, so we know if there's instructions that are antecedents to problem behavior and that there's some form of escape, we're probably going to include a demand condition. So I have possible FA conditions. Clearly, we're going to have a control. We always need a control. We're definitely going to have a demand because there are instructions, and there's seems to be an escape contingency provided. We might evaluate an attention condition because there is attention in this scenario here. The parent walks over and provides an activity. So not only is there attention, but there's a tangible item delivered. So I may include that tangible condition as well. Now, alternatively, we could look to variations, right? We could run a demand condition where it is escape to the iPad, escape to a tangible item, versus just escape to nothing, right? And we could verify, does a problem behavior cease when the person escapes the instruction, or is it the delivery of the tangible item? So we could kind of vary this escape condition if needed. Again, you always want to start simple and then drill down to more complex analyses. So at a minimum, I'm probably using these conditions here. Basic, control, attention, demand, maybe tangible. Could be 5-minute sessions, could be 10-minute sessions. Again, we're on a timeline, so we generally need, I typically start with 5-minute sessions. And if these results are unclear for whatever reason, I may be likely to modify the conditions to one of the ones below. This example here, Bill elopes from the classroom. So clearly a control condition will be needed, maybe an attention condition, maybe a demand condition. Some variations would be, controlling the elopement analysis to either allow for escape to the cafeteria or restrict the cafeteria, but he could escape somewhere else, see what happens there. Or you could vary antecedent conditions. I'd probably move to varying antecedent conditions before modifying the consequences. But again, we're typically going to start in a more basic analysis. Okay. So for the FA, it will be informed by our observations or indirect analyses, and we need to thoroughly prepare before jumping into this. We're going to get clearance from the parent to do these analyses. So we'd want some form of consent. We'd want to describe specifically what's going to happen. We'd probably want to describe the fact that they may be needed to participate in these conditions, right? And I've done both, where I've been able to run the functional analyses independently, but other times I've needed to have the parents participate to make it more natural. You want to consider how you're going to run it. Are you going to be formal about it and really contrive these analysis conditions, or are you going to use some form of brief analysis, 5-minute sessions? You're going to use it trial-based, latency-based, what conditions you're going to include. So we always work by way of a protocol. So what I recommend and what I do in practice is I analyze those indirect assessment data and I write up what the functional analysis is going to look like. I describe the conditions, I describe what data are going to be collected, and I review that with the parent. Here's what I'm going to do. The benefit of doing that is it keeps us accountable, and it gives us sort of, again, a roadmap, if you will, for here's what's going to happen, right? We don't want to get into this habit of sort of halfway knowing what we're going to do. Well, we're going to run a control versus attention condition, and no particular procedure for doing so. You're just basically there, so you manipulate things. Now, I will say I have done that only as a means to sort of determine if I should test in this area. So what I'm saying there is I've done what we might consider a probe session or analysis. So if I'm at the end of an observation and I'm suspecting that there might be some variables at play, I may quickly, without a protocol, maybe even without collecting data, do some manipulation just to see, is there some sensitivity to a particular reinforcer or consequence there, or antecedent condition? And if so, then I would write it up in my functional analysis procedures and come back and formally test that. And then we're going to run our assessment. It is not uncommon to begin your assessment, start collecting data, only to realize that you have to make some revisions or possibly restart the assessment for whatever reason. And the assessment is complete when your results are clear. Again, if you're on a timeline, you need to move through this quickly. Sometimes the assessment results are not always clear, but I would say it is better to have done it and produce unclear results and have to make decisions based on that than it is to not do anything functional analysis related at all. Then, of course, you're going to summarize your FA results. And regardless of where you are, this is a common practice that you summarize your results in a report. Then, of course, we are going to move to design our intervention. And we'll talk more about this a little later in the semester here. But again, this is a review of 510 and 511. So our approaches for reducing problem behavior are antecedent-based strategies and consequence-based strategies. If we know the antecedents that are influencing the occurrence of behavior, we can manipulate them in some way, if we have the ability to do so. And of course, if we understand the consequences that are maintaining the behavior, we could rearrange them to promote appropriate behavior, replacement behaviors like functional communication, and so forth, or we could use the reinforcers to reinforce the absence of the behavior. So we'll talk about specific interventions moving forward. The reason I wanted to go through this process is, one, because it's been at least a couple semesters since you've had ABA 510, and then there was even a summer break between 511, and of course we were disrupted by COVID-19. So I do want to use a large part of this course for reviewing material that's been covered. I think this will only benefit you, whether it is reinforcing the knowledge you already have, giving you more exposure to content that will be on the BCBA exam, but also just reviewing the clinical process. All of you are in practicum, you're working with BCBAs out there in the field. Maybe you're running skill acquisition programs, maybe you're running behavior reduction programs, but I think it's worth it to review what actually happens when you're out there as a BCBA. So as I mentioned, this focuses largely on problematic behavior. I think we will discuss designing skill acquisition programs as well. Most of you, I think all of you are in ABA 514, so we're covering that there. That's why I elected not to add it in here. So having said that, this week is still fairly light. I think I may post a link to a video that I want you to view as just review. And I think I received everybody's practicum application, or at least those of you that are under a practicum arrangement. So it's a light week. Next week, we're going to get into defining and measuring behavior. Then the following week, we will meet again for a virtual session. So the goal of this virtual session is to discuss things that we're reviewing now, but more importantly for those in practicum, to discuss what's happening out there in practicum. Are you acquiring skills? How are your indirect hours coming along, and so forth. So if there are any questions, don't hesitate to email me. I was able to change my office line to forward to my home line, so feel free to call my office during office hours, of course, and it'll forward to my home line, at which point we could have a conversation. Okay, that is it. Have a good weekend, and again, if there are any questions, feel free to reach out.